This is such an important topic, and I think we can all agree there's been a lot of stress during the pandemic and during the fight for equality in the country right now. So I spoke to Dr. Candace Jones from Edgewater Pediatrics over Zoom, and one of the first questions I had for her was, how has the news of George Floyd's death impacted our health?
We had daily stresses in all of our lives, and then we had COVID pandemic, and then now we have, over the past couple of months, we're learning of multiple deaths of African Americans unjustly, and now George Floyd's death that everybody could see on camera. And it's a lot of stress on everyone. And then when you take the African American community, who has felt for a very long time, frankly, over 400 years in this country, of dealing with oppression and discrimination and racism. We've come a long way, but there's so far to go.
And as a pediatrician, Dr. Jones says this stress is also weighing on our kids.
In the African American community, we have the talk with our kids. I have an 11-year-old Black son, and my son has heard the talk. He knows about racism. He knows our history in this country. Most kids may get a little bit with Black History Month, right? Watered down versions, short versions, but it's a tough conversation to tell an innocent child that unfortunately this world is unfair, and that it's unfair based on the color of people's skin, not the content of their character. And so it's important that we all, not just African Americans, talk to our children about racism. We have to be upfront.
And some of those watered down versions, she said, are just not enough. Dr. Jones says we all have to educate ourselves about the history of African Americans in this country and then answer the questions our kids ask in an honest and age-appropriate way.
If you have a very mature 4-year-old that is asking you about this, definitely have the conversation. Don't sugarcoat it. Don't brush them off. Tell them the truth. I find that children really relate to stories and songs. There are wonderful cartoons, PBS Kids, Daniel's Tigers, wonderful books that talk about race and racism. That will be a great starting point for kids in that age range.
And in addition to being a pediatrician herself, Dr. Jones is a spokesperson for the American Academy of Pediatrics. Last year, they released a policy statement about the impact of racism on kids' health.
It goes into the nuances of what racism is, how it shows up in our daily lives, how we can talk to our kids about it, and how we can equip them to be anti-racist and ourselves. So I really encourage people to look at that. You can go to healthychildren.org and get that document and a whole lot of other great information on combating racism.
And that's probably work that's been done by many different people in our medical community. I mean, the American Academy of Pediatrics is a source that, as journalists, we look to all the time. So what does it mean to you to be a part of that?
It means a lot. It really means a lot. And really, as an African-American woman physician, it means a lot that they have taken on this as a point of advocacy to improve the health and well-being of children, because there are so many organizations that are not, still not recognizing this impact of racism on our lives.
So Dr. Jones ended our conversation with some tips on the best things that we can be doing right now. So first, talking to our kids and making sure that their questions are answered honestly. Then, limit the exposure that you're having to some of these major issues if they're raising your stress levels too much. Maybe just check in once or twice a day when there's an alert. Also check in with yourself and your loved ones. She says, to work on learning about each other. That's an important part of this. In the end, we are all more alike than we are different.